Hello, everyone. Okay, welcome to Open Office Hours. I'm Dr. Jennifer Rollins of Well Woman MD. And open office hours, I just want to sort of mention about the first couple slides are just about open office hours and what this means. So, what is it? So, open office hours are actually every Tuesday at 6 p.m. Pacific Standard Time. What it is for the first 20, 30 minutes, I'm going to just do an educational webinar about different topics that I think I get asked questions about or I think are really important to talk about at this time. So today we're talking about IBS because recently I saw a patient who was dealing with IBS and what the difference between IBS and SIBO is. And then sometimes I'm going to have a featured guest. And so actually on the 22nd of March, I'm going to have an acupuncturist who works in Fullerton, California. And she's going to talk about different uses for acupuncture and hormone health. And the great thing about having this guest is it's really interactive. You guys can ask her questions, you can discuss what you want to discuss about her topic. And it's really just more of like you're going into an office hour. So, and then after that at 6:30, then those that are in my practice, active members and also deluxe members, those are people that are actively seeing me, and then those that are on the deluxe package, they can actually hop into a Zoom call. And that's where we just chat about whatever questions you have. It can be anything. And we can just discuss, what's bothering you, any recommendations that have come up, whatever you would like to ask. This is your chance to actually send me an email ahead of time if you want and let me know if you want to talk about a particular thing. Then I'll make sure that you're on the hot seat, that we ask your questions. I do not record the second half because this is health information. I don't want people to feel like that part is being recorded. So it's really just a Zoom call between a community of women. So this first part is recorded, is streamed into both my YouTube channel and Facebook group. And that way you have that information anytime. I will put up these live comments, and that way I can answer any questions that come through. But if you have specific questions you want to ask me personally, you're going to have to join the membership so I can ask them. I can answer those. So just a reminder that these open office hours are voluntary. They're confidential. We want to respect each other. So if someone asks a question, then you need to wait for their answer. And also, you're welcome to give your advice and your experience too. I want everybody to be non-judgmental and encouraging of other people. It's really about empowering other women to help. And then open to suggestions that might be from other members. It's really a matter of women helping women. And so this is a great opportunity for people to just get together in a community. Why do we do this? Well, I do this because people sometimes ask me questions through Instagram or TikTok, and I want to be able to give that information out to people. And it's much easier to answer this in a group setting rather than individual people. Also, some people may not be able to work with me because I have a cash-based practice. So this allows them to get their information answered without actually having to be a member if they don't need to. And then it also allows for connection. So let's dive into IBS, or Irritable Bowel Syndrome. So IBS stands for Irritable Bowel Syndrome. And basically, Irritable Bowel Syndrome is a collection of different symptoms. So when we use the word syndrome in medicine, it means it's different than a disease. A disease says, you know what, here's a test. I've proven you have this disease, like diabetes. Diabetes is a disease. You take this, you get your fasting blood sugar or hemoglobin A1C or however you're being diagnosed. And if your test result is abnormal and you qualify for that disease, then you have that disease. Versus a syndrome is really a collection of symptoms. And really what we're saying is that we've excluded everything else, and therefore it meets this criteria. So it's a collection of symptoms that often people sort of refer to as spastic colon. And it often involves different types of symptoms. So sometimes it can be bloating, it can be constipation, it can be diarrhea, it can be, people often describe feeling like they are pregnant after they eat. It's very common, actually affects 10 to 15% of adults in the United States, and is second only to the cold as a number one cause for people missing work because they just can't function if they're feeling that way. It affects more women than men. In general, like I mentioned, it's characterized by a collection of different symptoms. So abdominal pain, constipation, diarrhea, gas, bloating. Sometimes people see blood in their stool, mucus in their stool. It's just a collection of different digestive symptoms. There are typically three types of IBS characterized by whatever symptom is dominant for you. So IBS-C is constipation, IBS-D, diarrhea, IBS-M is a mixture of both. So typically alternating between constipation and diarrhea. And most people are diagnosed and the treatment regimens are based upon which type of IBS you have. There is no specific test for IBS. If you've ever gone to the doctor and you think that you have IBS and you've asked about it, they'll often ask you questions, but they do not have a specific test for IBS in general. So you have to have made the criteria that you've had 12 weeks out of 12 months of symptoms. These do not have to be consecutive at all. They can be actually um, 2 weeks of a symptom, then 4 weeks of a symptom, as long as in a total year that you've had 12 weeks of symptoms. Hold on one second. Um, so and you can have constipation or you can have diarrhea. Either one, both are qualified for that particular. Sorry, my kids are coming in. But you have to have made that criteria, and that criteria again is 12 weeks. So IBS is commonly confused with IBD, which is inflammatory bowel disease. And inflammatory bowel disease is actually when you go and look by colonoscopy or any sort of scope where you actually can see inflammatory changes in the bowel. So inflammatory bowel disease is different from IBS because IBS is symptoms, but inflammatory bowel disease is actually where you see like evidence of ulceration or inflammation or bowel actual disease that you see. The other thing it can often be confused with is SIBO, which is small intestinal bacterial overgrowth syndrome. And we're going to talk a little bit about this because what's important about this is oftentimes people go into their doctor and they're told that they have IBS, but they're put on a probiotic sometimes. And if you have SIBO and you're put on a probiotic, you're going to instantly feel much, much worse because there's a big difference between SIBO and IBS. And we'll talk a little bit more about when we talk about the causes of IBS. So the treatment. So this is a sort of a chart of what happens in conventional medicine. What I mean by conventional medicine is it's actually your traditional OBGYN or primary care doctor that's in what most people see versus integrative or functional medicine or a naturopathic doctor. So diagnosis of IBS is typically made once you speak to the patient, you talk about their symptoms, you discuss, have they had those 12 weeks out of 12 months of symptoms? Do they have predominantly diarrhea or constipation? And oftentimes what's recommended is that people increase their physical activity and they increase their fiber intake and avoid stress. And if you have IBS, you've been told this, that they'll say, just stop stressing out. And the treatment is based upon a medication, and it is particular to the type. So there are medications for IBC, there are medications for IBS-M, and medications for IBS-D. What these medications do is so if you have constipation, then your bowels are not moving. And so they help kind of move your bowels. That's what osmotic laxatives means, is actually helping them move or peristalse your bowels. They also have medications that are antibiotics that help kill the bacteria that's in the intestine. And they also do medications for like depression and anxiety, because feeling like if they decrease your stress, then overall your IBS symptoms will get better. So all of these approaches to how you treat IBS in the conventional setting is, what are the symptoms? Like, are you having constipation? So therefore, if things are not moving, we need to get them to move. If you're not having constipation, you're having diarrhea, we need to slow things down. So an antispasmodic or laxative in a way, and antibiotics to kill the bacteria that's in there that potentially may be causing some problems, and then working on an antidepressant to decrease your stress. But this is one way to treat IBS, but the issue really here for me and what a lot of integrative and functional medicine doctors don't like is we're not really treating the cause. You're kind of putting someone on something lifelong. You're telling them that their bowels don't function correctly, so therefore you need to be on something to move your bowels or need to be on something to slow your bowels down. But why are they not working? What is the cause? Why does someone have IBS? And that's the difference between functional medicine approach and conventional approach. So when we look at IBS from an integrative standpoint, what we're trying to do is understand what is the cause? Why is someone having IBS symptoms? And typically when you look at IBS, it's usually that someone has a genetic predisposition to have that, and then something triggers it. So it could be an infection, it could be an inflammation, it could be high amounts of stress. Frequently, I hear from patients who said, this started after I got a divorce, or my first child was born and I had incredible amounts of stress, or I was traveling and I got an infection and GI parasite. So it's frequently something that triggers the actual IBS symptoms. And because the gut and the brain are connected, in fact, the nerve that innervates the brain, the vagus nerve, goes all the way down to the intestine. And as you know from other kinds of diseases that frequently whatever is going on in the brain can affect the gut, then you have to sort of treat it from an approach where you're addressing all of those factors. You're trying to understand what actually caused the problem, and then how can we treat it to be able to address both the brain and the gut. So when we look at treatment for IBS, we're really focused on what is the cause for what happened and how can we treat it with nutrition, lifestyle, and mind-body tools or mind-body medicine. So one thing I wanted to mention on causes, let's talk about different causes of IBS. Because I think it's important when you start to understand what it is that you're treating, you need to know what caused the problem. So SIBO, small intestinal bacterial overgrowth. In conventional medicine, SIBO is not recognized. We don't talk about SIBO because it's not the concept of having bacteria that moved from the large intestine to the small intestine where it's not supposed to be there and causing these bloating and gas problems is not a concept that we study in medicine. So therefore, we don't recognize it. We did just sort of say, well, I don't know what it is, so it's not an actual disease. But SIBO is very real. And this is, and how when I see it in patients, I see patients who say, you know what, I was told I had IBS. I decided to go get a probiotic over the counter, and I got so much worse. I had terrible gas that was so incredibly painful, terrible bloating, and I just felt terrible. And that's because what SIBO is, the bacteria that's not supposed to be there, it's supposed to be in the large intestine, moves into the small intestine, and it causes excess gas, excess bloating. It sort of takes over because of the excess fermentation of those foods in the wrong part of the GI tract. So often women will describe like they eat just a little bit and suddenly they feel like they have that pregnant belly. They're really bloated, terrible gas, just don't ever really, they're always hungry because they're not able to eat very much. Everything causes them bloating. And it just makes things worse when you put more bacteria into that environment. You're increasing the chance they're going to make more gas, increasing the chance of bloating. So it makes SIBO worse. And that's where there's a distinction between IBS and SIBO. It's important to understand what someone has and not just treat all IBS patients the same. And so what we do when these are different symptoms of SIBO too. So it can be more than just bloating, constipation. It can be diarrhea, fatigue, GI pain, headaches, acne. Sometimes people describe that they have like certain foods that really bother them. They get skin rashes because the gut and the skin are connected. And certainly they can often have vitamin deficiencies because the part of the gut that absorbs vitamins and nutrients is not working. So we treat it very differently in integrative medicine because we're trying to focus on how to get rid of that bacteria that's in the wrong location, and then how to eliminate whatever's triggering the actual problem. And then we oftentimes try to, it's sort of a process. I use this sort of weed seed and feed your garden analogy, which is that you want to get rid of the triggers or the things that are causing you problems. You want to seed it with the good bacteria after you get rid of those things that are the weeds. And then you want to actually continue to feed the garden good, healthy food that the bacteria thrive on. And so it's a little different approach than SIBO. If you give someone SIBO, if you give them a like Linzest, the medicine that's used for IBC, they typically get a little better, but they still are pretty miserable with bloating. It only helps them eliminate some of the constipation issues, but doesn't really help them with bloating, gas, and abdominal pain. Another cause of IBS is leaky gut, or essentially when these junctions that are in the gut that help prevent things from moving between, prevent things from coming in. There's sort of a barrier. And if those junctions are leaky, then they allow things that would normally not go through there, like toxins, different foods, high big size proteins in between those areas, and they can often lead to an immune reaction. Typically, you see leaky gut in women who have autoimmune conditions such as celiac, Crohn's, Hashimoto's, fibromyalgia, psoriasis, celiac, a lot of these autoimmune conditions, because what happens is their body starts reacting, their immune system starts attacking itself, wondering what is this sort of inflammation that it causes. Oh, my little, oh, okay. Anyway, I had a little slide with a picture of what leaky gut is. But oftentimes I recognize this in patients who describe having a lot of food allergies, food sensitivities. So they'll come in and just tell me that they can't eat gluten or they can't eat dairy because they have problems with particular foods. So oftentimes I'll discuss with them how to eliminate those particular toxins. So the next one I wanted to talk about is yeast overgrowth. So in the gut, there is bacteria and there's yeast. So if you have too much, if you have an imbalance in bacteria and yeast, then you can get yeast that overgrowth. And that's typically causes a lot of problems with skin issues. People can notice they have a lot of more fungal infections. So they may get like, the white patches on their tongue. They may get more yeast infections in the vagina. They may have just overall skin issues and yeast issues. So that can often cause the gut to be in imbalance, and then they get IBS symptoms. Heavy metal toxicity can also occur, although really less common. Usually it's exposure to heavy metals. So those are ones you're going to have to get lab testing if you think that you may have exposure. This can be in contaminated water, soil, all kinds of locations. So if you are concerned based upon your occupation or you have symptoms like hair loss and weird metallic tasting, sometimes neuropathies, then you probably need heavy metal testing. The last thing is vagus nerve. So the vagus nerve, like I mentioned, it goes from between the brain and the gut. It connects the brain and the gut. When we talk to women who have chronic stress, they have been living on a high stress environment for a very, very long time. They oftentimes will develop IBS symptoms because what affects the brain also tells the gut what to do. And so oftentimes women are put on SSRIs and they notice that their symptoms are better. So SSRIs are like Lexapro, Celexa, Prozac, that kind of thing. And they notice that their symptoms are better. And that's usually related to this vagus nerve, that they have a poor vagal tone. So if you think you have these symptoms, what should you do? Well, you should ask the right questions. If you're being diagnosed with IBS, I think that you should ask your doctor, what is causing my IBS? Do you see any signs that I might have difficulty absorbing certain foods? Like maybe I have a nutritional deficiency. Do I need to be tested for vitamin D, vitamin B, other nutritional like zinc, nutritional deficiencies? What supplements are specific for my IBS? Like what can I take to help reverse my IBS symptoms so I'm not stuck on Linzest or I'm just picking a med long term or lifelong? What other tests should I have that might be contributing to my IBS? I mentioned that there are, if you have SIBO, there are other tests you can do for SIBO. It's a breath test looking at excess hydrogen in your breath. So you could have that testing to rule out SIBO. And is there a specific diet that I should be on in order to avoid my symptoms, to make them better? So, an integrative approach really does address these questions. So, we take a good history. Appointments are usually an hour long. We test for nutrient deficiencies to see if part of the symptoms you're having are related to the fact you're not getting the proper nutrients and minerals, vitamins and minerals, both. We talk about what is the right diet. Is it something like an elimination diet where you get rid of all the common triggers like gluten, dairy, soy, wheat? Or do you need to be on a low FODMAP diet, which is a diet for SIBO? Or do you just need to focus on an anti-inflammatory diet? What kind of diet is going to work for your cause? We discuss stress management and how you can eliminate stress, because certainly the mind-body connection can make these symptoms worse. And then we talk about supplements and herbs that can help reduce your symptoms. And sometimes these can be things that are temporary just to make you feel a little bit better. And sometimes these can be things that you need to continue to supplement until you can do it through your diet. But the most important part is that you need to know your triggers so that you can prevent this in the future, because really you are your best healer. So I just wanted to mention two supplements just to put that information out there, because I think people don't know a lot about supplements and think that, it's over the counter, so I can just pick up anything I want. One supplement that I frequently use for people with IBS-C is peppermint oil. Peppermint oil has a normal intrinsic property that actually helps benefit women with IBS-C. It causes the smooth muscle channels to move more appropriately in the gut so that you actually can eliminate stool much easier without having to sort of be stuck on a laxative long term. Sometimes it can actually help support an anti-inflammatory help with reducing inflammation, and also will help with the symptoms of bloating and pain associated with IBS. The other thing is digestive enzymes. If you're someone who has a lot of food sensitivities where you don't do well eating certain foods, digestive enzymes can actually help you break down the food more appropriately to get the right vitamins and nutrients. It's usually helpful for all types of IBS. And these are plant-based, so people typically don't have problems. So they help you digest carbs, protein, fat, depends on what digestive enzymes are actually in it, and will help you to basically absorb those nutrients better while your gut is healing.